Hi, this is Dr. Siddharth Lakhani, consultant nephrologist and transplant physician at SL Raheja Hospital of Fortis Associate. Topic of discussion today is renal transplant and its challenges. A renal transplantation is a process by which a patient is given or transplanted a kidney. This is the indication for transplant is either a patient is on dialysis or patient has a progressive kidney disease soon going to lead to an end stage disease or to dialysis. Who can be transplanted? Any patient who is on dialysis or probably is progressing to CKD. Age limitations, patients up to age of 65 or maybe beyond also can be transplanted. Donor, the donor age usually is around 65. You have extended criteria donor where you can select donors up to 75 who are pre-morbidly healthy. A donor who's probably from the family or a near relative can be selected. Blood groups, we have transplant which is ABO compatible and ABO incompatible transplant. So even if the blood groups are not matching, the relatives or the donors can transplant to their near and dear ones. We have transplants which also include HLA match or an HLA mismatched transplant. So for probably like husband and wife, the wife will be a donor to a husband or an husband will be a donor to wife, though they are genetically not matching. So transplants are possible in these situations also. It is important for a patient probably who is leading or progressing a kidney disease to discuss transplant related things, or a doctor also to explain patient that transplant is an option. Transplant becomes the best option because the survival in a patient of kidney transplant is maximum. If you see first 5 year or a 10-year survival, 10-year survival is somewhere around 80% and first 5 year survival is somewhere around 95+%. So definitely it is survival is better than dialysis. For patients who don't have donors at home, we have a deceased donor or a cadaveric registration for transplant. So it is important, if you don't have a donor, inform your doctor. Doctor will register you across your zone to any one of the government or private hospitals for a cadaver or a deceased donor registration program. It is important to remain healthy on dialysis so that you are eligible for a fit transplant. Post-transplant, there are a lot of myths that patient has to live in a probably four walls, cannot go out. It is not like that. What is important or what precautions to be taken post-transplant is what I am going to discuss today. First is avoid infections whenever possible. Stay away from infected patients. Second, self-hygiene, personal hygiene and food hygiene, that is important. Don't take any raw foods or probably foods which are stale. Second most important factor. Third most important factor for a transplant patient is to know and to take their medicines on time. That avoids rejection and avoids complication related to transplant. Fourth is to remain healthy. Fifth, of course, if you are a diabetic and hypertensive patient, you will have to control your diabetes and hypertension so that your new transplanted kidney also doesn't become bad. So these are important factors for a transplant patient. Staying home is not important. You can stay along, you can be fit. Stay precautions like using sanitizers wherever required, masks whenever required, and stay away from infected or probably airborne or sputum-borne infections which are common in air and that can probably transplant or give infections to transplant patient. Important diet is very important for a transplant patient. You have to have adequate amount of proteins, adequate amount of carbohydrates, adequate amount of fat and multivitamins to keep yourself fit. A dietary transition from a dialysis patient to transplant patient is very important, because if you lack proteins you are going to feel fatigued and you are going to feel weak, and transplant remains the best option. So whenever possible select transplant. Thank you so much.